So at this stage, we are going to start by telling you what the story is, by starting with the problem. And in looking at that, we'll share with you some of the trends of the problem as it is and what we think some of the factors that are associated with it are. Typically, when we think of stunting, we refer to this UNICEF framework, and we see that already is a complicated framework, right? But the main key aspect of it is there's a dietary component to it contributing to malnutrition. There is health, there is water and sanitation, agriculture, social protection, the economy. But it also gives us an idea of what are the areas we should be focusing on when it comes to interventions. And then we also did this regression analysis with the data that is available. So we used the demographic and health surveys. We had full data for 2003 up to 2014, and that's what we did the regression analysis on. This is the conversations we had with, this is to show the conversations we had with the stakeholders. We talked to 25 different institutions, trying to understand from their different perspectives what kind of interventions they have been doing, which has worked well and which has not worked well. And then we did this very interesting interviews where we brought stakeholders together for them to be able to identify who are you working with, who are your partners working with, and then they then created sort of a map of those relationships. And in addition to those maps, and this is some of the diagrams that come out of it, that shows who is most influential in that relationship. In every relationship, there is someone who has more influence, if it's in funding, if it's in technical support, and we try to measure those kinds of relationships. So at this point, I'll invite my colleague, Ifwa, to come and share with us the key findings. And she will do this, again, focusing on telling us what the problem is, but also some of the policy and program aspects. Then I'll come and continue with the rest.
Thank you. So I'll continue with the problem. Looking at stunting, we see that it has declined, but then it's unequal. Looking at the regions as well, we see that the northern region is not doing so well. With anemia, we saw it's declined marginally, and then also across the regions, we have the northern region standing out, not doing so well. Looking at diet, so for the diet, you look at breastfeeding trends. Breastfeeding, we have done well at some time, and we haven't done well at other times. So looking at exclusive breastfeeding, in 2008, we did very well, but then there's been a decline. With complementary feeding, we see that there's a decline in the minimal acceptable diet. And we are not doing, we still see a decline looking at the 2017 mix. Healthcare access, we see that there's improvement with coverage of health insurance. And then also with infection rates, we have done well. The health systems. So we see that for the child sleeping at that insecticide treatedness, we have done well, and also for the pregnant woman. And for vaccination and deworming, we have also done well for fully vaccination. But then for pregnancy, deworming during pregnancy and then that of the child, we are at virtually the same place. Vitamin A intake. So we are doing well. There's a bit of a decline. And then the iron intake, we haven't done so well with that over the decade. Water and sanitation. So there's been an improvement. We see that with shared sanitary, shared toilets, and then also the non-sharing. We see an improvement with these ones as well. And then the quality of the household water. So we see that in 2014 we did very well, but then we declined over the period. Poverty and food security. So for the GPA, we are going up, but then for hunger, we see that it's fluctuating. At a point in time, we are doing well. At that time to 2016, 2018, we've dropped. So looking at the policies and programs, these are some, not everything, these are some of the policies and programs that we found. Food fortification program, this was prior to 2008. And then the MetaSIP, this was in 2009. So we are going to share this and would receive feedback to be able to tell us if we have missed anything on these programs and policies that we have here. So we have nutrition-specific policies and programs. There's food fortification for the diet, biofortification, then micronutrient supplementation, and then for the health services, we have infection control, malaria and deworming, and then also family planning. When we look at the nutrition-sensitive programs, we have water and sanitation, potable water, hygiene, social protection, we have gender programs, we have cash transfers, social health insurance, food and nutrition security. Also, we have agricultural productivity, and then social and economic interventions. So all these are policies and programs that are ongoing in the system. Capacity coordination. So this is something that we found, that the Ghana Health Service Nutrition Department is the main lead for nutrition programs. And NANUPAC, cross-sectoral planning for NDPC, Ghana Health Service also has limited convening capacity. So for capacity and coordination, these are some of the challenges we found. Ability to harness policies, there's a limitation, and then also a limited capacity to track funding across sectors and agencies.